I welcome you all in the session of Dr. Hitendrakumar Patel, Professor, Department of Chemistry, Sardar Patel University, Vallabh Vidyanagar, Gujarat, India. He has 24 years of experience in teaching and 17 years of rich experience in research. His research interest includes development of bioactive heterocyclic scaffolds via multi-component reactions with a focus on green chemistry approaches and medicinal chemistry, including synthesis of small molecules, virtual and biomolecular screening. He acts as a reviewer editor in Organic Chemistry section, Frontiers in Chemistry Journal, and editorial board member of Frontiers in Chemistry and in other international journals. He was an elected member of the Organic Division Council and was admitted as a Fellow of Royal Society of Chemistry, London in 2020. He has been granted two projects to a tune of rupees 51.81 lakh from national agencies like DST Serb and UGC New Delhi. He was selected as a brand ambassador of Bentham Science Publisher for the year of 2018-19. He had given many invited talks in many national and international level conferences at different universities. He had received the Outstanding Contribution Award for reviewing Journal of Molecular Structure and also received Distinguished Faculty in Science Award 2017 by Venus International Foundation, Chennai, India. He worked as an expert reviewer in many international journals and received Top Peer Reviewer Award 2018-19 in Chemistry from Publons. He has published 30 research and review papers and 3 books and book chapters. He has total citation of 453 with H index of 13 and I-10 index of 18. Thank you.
Good morning, friends. Namaskar to all of you. Today I will talk on introduction of ADME tools for medicinal chemistry. Let me try to show you the full view. So when we talk about a medicinal chemistry, then definitely the two important words came in our mind, that is pharmacokinetics and pharmacodynamics. So specifically, I will discuss briefly with the ADME tools for the pharmacokinetics. So ADME tools for the medicinal chemistry, specifically in the case of pharmacokinetics, and then the route of drug administration. So this route of drug administration, briefly, I will discuss with you for the drug absorptions, drug distributions, drug metabolism process, and drug excretion, or we may call it drug elimination. So friend, this ADME tool is very, very important when we synthesize a new molecule and we have to check the efficacy of our drug molecule. So then these 4 important parameters for us when we talk about the medicinal chemistry. Now let us see here the pharmacokinetics. So pharmacokinetics is showing term as a PK. That is nothing but pharmacokinetics. So abbreviation is, small abbreviation is PK. Now the pharmacokinetics is a study of a drug movement within the body. So friends, whenever we have to take a drug molecule through the oral route, then how the drug molecule moves towards our body, so that kind of parameter we have to check it. So major aspect of this pharmacokinetics is described in the is described mainly as a the ADME, specifically for this the absorption, then distribution, and the metabolism and excretion. So these are the 4 important words, and we will discuss one by one these each parameters. And these 4 important terms as a absorptions, drug distribution, drug metabolism, and drug excretion, that part I will discuss with you. Okay. So friends, this pharmacokinetic is nothing but it's a branch of a pharmacology, and mainly we have to learn that the destination of a substance administered into a living organism, right? So after taking a oral drug administration, so we have to understand the substance that is administered to the living organism. The substance of interest includes the chemical xenobiotics, such as the pharmaceutical drugs, pesticides, food additives, and the cosmetics. So, on the other hand, if we talk about the pharmacodynamics, so then pharmacodynamics is nothing but it gives us idea regarding the therapeutic effect of the drug, how drug works on the body. Whereas the pharmacokinetic, that means after taking a drug molecule, suppose through the orally, how the drug moves towards the body, that we have to check it, right? In terms of drug absorption, drug distribution, drug metabolism process, and drug excretion. Whereas in pharmacodynamics, specifically, we have to check that the therapeutic effect of the drug. So that means how drug molecule works in our body with a specific target, right? So to study the action of a drug in the body with different methods, just like rate of excretion and the time course of drug effect, that we have to check with this pharmacodynamics. Now, let me try to explain that in short view, that is the pharmacodynamics. So, in pharmacodynamics, the many drug molecule that inhibits the enzyme, right? So, many drugs molecule that inhibits the enzyme, and the enzyme control a number of metabolism process. A very common mode of action of the drug that is observed, specifically the ACE inhibitors in the patient, and in microbes we may talk about the sulfas as well as the penicillin drug molecule. And suppose if we can have this 5-fluorouracil or 5-mercaptopurine, specifically we have to use it for the cancer cell, right? So, on some of the other drug molecule, they bind together with the proteins, specifically with the microbes in the patient, and the genome, that means the cyclophosphamide, and microtubules, that means the vincristine. So, these are the important terms for this pharmacodynamics, where we have to check the efficacy with the specific targets, and we have to also see that how the drug molecule that binds together with which kind of terms. It may be a protein or genome or microtubules. Now, when we talk about this pharmacokinetics, that means, as I already explained, that the ADME tools is very, very necessary for the medicinal chemistry concept, because we have to design that the drug dose that is based on these four important parameters. So, one, that is drug administration. So, drug administration, that means how we take a drug molecule, right? With which route we have to use the drug molecule, either in capsule form, either in tablet form, either in liquid syrup, right? Or maybe through the injection. So, the route of drug administrations I will discuss with you briefly, and then after I will discuss with you the drug absorptions and the drug distributions and drug metabolism and the drug excretion. So friends, the simplest, the example is shown over here with the figure. So there is nothing but the principles of the ADME. Now let us see, if we have to take any medicines through the oral route of drug administration, so then first important terms as A, that means the absorptions. So how the drug absorptions occurs. So how will it get in, right? After taking a oral dose of drug, so absorption, from where the absorption is started, okay? Then the second parameter, that is drug absorptions. After drug absorptions, we have to think about the drug distribution. After the absorption of the drug molecule, so how the distributions is take place in our body. That means the where will it go, right? After drug distribution, that means the transportation of the drug through the blood-brain barrier, you can see here. So how the drug molecule can be distributed, that you can see with this arrow. And then after, we think about the drug metabolism process. The third point is the drug metabolism process. So that means how this drug molecule is to broken down, isn't it? So through the metabolism process, how the fragmentation of drug molecule is take place, that you can found out, right? So you can understand here the drug metabolism processes take place, and then after we talk about the drug excretion, right? So when we have to have the therapeutic effect in our body, we have to see that the drug eliminations is take place, right? So these are the four important terms as a drug absorptions, drug distribution, drug metabolism process, and drug excretion, right? So this is the principle of the drug principles of this ADME with this pharmacokinetics. Now, when we talk about a pharmacokinetic matrix, at that time, so the important term is required when we go for the identification of a bioavailability and the first order kinetics, second order kinetics, and we have to design the drug dose. For that, it requires this term. So let us see here. In this table, you will find that the characteristic as well as the description of this characteristic, the terms, and the symbols and unit and the formula. Now just I will show you that the different terms and their description. Let us see here dose, drug dose. So amount of drug administered, that is symbol is D, right? And the unit is mole. So the dosing interval is nothing but it's a time between the drug dose administration. It is shown here, the symbol, that is tau. And when we talk about the Cmax, Cmax is nothing but the peak plasma concentration of the drug after administration, and the Tmax is nothing but the time of reach, that is the C maximum concentration, that is maximum here. Now the C minimum, that means the lowest concentration that of the drug reaches before the next dose is administered, right? So that is called the CMIN, C minimum, isn't it? And the another one, that is the volume of distribution. So volume of distribution is very, very important after taking a oral route of drug administration. You can see that how the drug can be distributed after the absorptions, that is shown here. We can calculate the volume of drug distribution in the plasma concentration. So the apparent volume in which a drug is distributed, right? So that we have to, we may call it the apparent volume of drug distribution, right? So here the example is given, the parameter that related to the drug concentration in plasma to drug amount in the body. So there is nothing but it is known as the VD, that is symbol. This is the symbol of volume of distribution. Now the concentration. So concentration, the amount of drug in given volume of plasma, isn't it? So after drug distributions, the amount of the drug distribution, how it is happened in the drug in the volume of plasma, that we have to found out the amount of drug. Okay, so that it may be the label, it is labeled as a C0 and CSS, right? So another terms, that is the absorption half-life. Absorption half-life is nothing but the time required for the concentration of a drug to double its original value for oral and other extravascular routes. And the another one, that is absorption of a rate constant, that is nothing but the rate at which a drug enters into the body for oral and other extravascular routes. And here another one, that is the elimination of a half-life, that is nothing but the time required for the concentration of a drug to reach the half of its original value. So friends, there is nothing but the different kind of term is there, and the distributions and symbol is given here. So similarly, the elimination of a rate constant, there is nothing but the rate at which a drug is removed from the body. So there is a KE, that is the drug elimination constant, right? So infusion rate, so there is nothing but it is called the rate of infusion requires to balance elimination, right? That is the KIN. And the area under the curve, there is nothing but the integral of the concentration time curves, which is shown here. So that is AUC, and that is a tau, and SS, steady state level. SS is nothing but steady state level. And the clearance, so for the clearance, that means the volume of plasma clear of the drug per unit time, that is CL. And the bioavailability, we have to check the bioavailability, right, after taking a drug dose. So the systematical available fraction of a drug molecule, I'll show you with the diagram for the bioavailability also. And fluctuations, that means the peak through the fluctuations within one dosing interval at steady level. So that is percentage PTF, that is the symbol of the fluctuation. So friends, these are the terms which is required when we go for the calculations of the bioavailability and the volume of drug distribution and the absorption half-life. So for that it requires, okay, and the formula is also given. Now let us see here, when we talk about a brief background of this, the route of drug administration, then mainly the route of drug administration is classified into the two important parts, that is the antral route of drug administrations and another one that is the parenteral route of drug administration. So friends, you can understand these four ADME tools for the pharmacokinetics. We have to check that the whole bioavailability into the body after taking this the drug absorptions and distribution. So where we can have the bioavailability with the plasma concentration. So friends, this is the predictive ADME is shown over here. There is the figure. You can understand easily that by taking the oral drug through the oral route of drug administration through the mouth, then tongue, and you know that the pharynx as well as the esophagus and pancreas, and then you can see that the drug molecule goes into the liver, and then how the distributions is take place, that you can understand. I will show you with the different kind of reactions which is happen in phase 1 and phase 2 after this route of drug administration, after taking this drug molecule. So the two, as I already explained, that the two type of drug administrations we have. One, that is the antral route of drug administration, and it involves the esophagus, stomach, and the small and large intestine, or we may call it the gastrointestinal tract. And the method of administration, it includes mainly that the oral and sublingual. There is nothing but the dissolving the drug under the tongue, right? So oral, that we know very well, but the sublingual, that means some of the drug molecules we have to put into the under the tongue, isn't it? That is directly dissolved, and the target, the effect is observed after a shorter period of time. So there is nothing but it is called the sublingual route of drug administration, and then rectal, that is in the antral route of drug administration. When we talk about the oral route of drug administration, then the many drug molecule administered orally as a liquid, or maybe the solid, or maybe the capsule form or tablet form, or maybe the chewable tablets we can have, okay, and sublingual, or maybe the buccal routes of this drug administration. And when we talk about the another kind of the drug administration, that is parenteral route of drug administration. Parenteral route of drug administration. So the parenteral route of drug administration is the most effective route for the delivery of the active pharmaceutical substances with the narrow therapeutic index. So friends, when we talk about a therapeutic index, then at once we can have a good therapeutic index, then we can have a good value of our drug molecule. So when we talk about this, the narrow therapeutic index, then the poor bioavailability is there specifically for those drugs prescribed to the unconscious patient, depending upon the what kind of causes we have and which kind of drug we have taken. So based on that, it requires the bioavailability with the specific tissue level or organ level. Now, when we talk about this, the second classifications of the drug administration, that is parenteral route of drug administrations. Another, the route is shown here, that is injection route and rectal routes, vaginal routes and ocular routes, otic routes. And it is otic routes, that means we know that the ofloxacin, that is the otic solutions we have to use this for the treatment of the infections of the ear or eye, ear with the canal and the nostril routes. So friends, these are the two important terms as the antral route of drug administration, and another one that is the parenteral route of drug administration. So you can easily understand the important terms as a route of drug administrations by the figure. So friends, we know that the intravenous, this is one of the important route as a intravenous, okay, through the glucose bottle, intravenous, we provide the drug route of drug administration. Another one, that is intramuscular, and the third one, that is a subcutaneous way. You know that with the layer of skin, you can see the subcutaneous way. We have to take the injection, and another one, that is the local effect, the topical. Just we have to rub it on with the effective area. And another one, that is a rapid target drug molecule, that is the inhalation, right? A quick effect that can be that we have with these inhalers, right? And as we know that the oral route of drug administration, there is nothing but the portal circulation sees happen. Any drug molecule, if we have to go through this route, then the portal circulation sees happen, and through the liver, the first pass, the metabolism process is take place. And we can understand that the rectal route of drug administration, in which we can have this 50% of the first pass metabolism process, and sublingual, as I already explained that, below this tongue, we have to insert the drug molecule, and quickly we can have the effect. There is a rapid effect is happen, and no first pass that the metabolism is take place. And another one that you can understand, that is intrathecal. Intrathecal, you know that. As we know that intrathecal, that means in Gujarati we can say that the કરોડરજ્જુ માં જે injection મૂકવામાં આવે છે, that is called intrathecal. And another one, that is a transdermal the route of drug administration, so which will sustain the particular effect. So friends, this figure which will clarify us the important terms. Again, we can see that the ocular delivery with the eye, specifically the eye drops and the bioadhesives that we have taken. This is the ocular delivery route. Another route, buccal delivery route, that means the mucoadhesive and the spray directly through the mouth. Similarly, the sublingual delivery in terms of the tablets we can take, and the oral delivery, that means the capsule and pill we have to take it, and intravenous delivery through the injection, that is nothing but you can see here the intravenous delivery, and the intramuscular, you know that with the muscular we have to inject it, that is a default, and the subcutaneous delivery, that means depot with the implant, and the transdermal delivery, that means the patch and cream and spray, that is a transdermal delivery. And the pulmonary, or we may call it the nasal delivery with the aerosol and spray, we can have the quick effect of the drug molecule. And another one, that is the vaginal, that means the rectal delivery with using the gel based drug molecule and the suppository. So friends, there is nothing but it's a various route of drug administration. Now, whatever the enteral route of drug administration and parenteral route of drug administration we have seen, most frequently the use of drug administration, that is oral route of drug administrations, which is most convenient us, and it is cost effective, so that's why it is preferred one. And although the solid dose form such as the tablets and the capsule have a high degree of high degree of the drug stability, that's why it shows the advantage, and it provides the accurate dosage when we have to take a solid dose form through the oral route of drug administration. But some of the limitations is also there with the oral route of drug administration, that is the problematic. It creates a problem because of the unpredictable nature of the gastrointestinal absorptions. Right, so that's why we have to take care about this the oral route of drug administration. For example, the food in the gastrointestinal tract may alter the gut pH and the gastric motility and the emptying time, as well as the rate and extent of the drug absorption is take place. So patient sometimes tolerance of the solid dose forms also varies depending upon the age of the patient, and whom liquid or solution that is preferred one for the very older patient. And however, the many drugs are not stable in the solution. Another disadvantage of the oral route drug administration, that is the many drugs are not stable in the solution, and such as the alternative drugs should be considered in such cases. Now the drug absorptions. Now let me try to explain that the drug absorption. So drug absorption is nothing but it is a movement of a drug into the bloodstream after the route of drug administration, right? So there is nothing but the movement of a drug into the bloodstream. There is nothing but the drug absorption. uh, and it will be started at once we have taken a drug molecule orally, then quickly that the absorption of the drug is started from this lungs also, and then with the body, right? So there is nothing but the absorption is another important parameter for this ADME tools. Now the absorption effect, which will increase the bioavailability. Absorption effect, whatever the absorption capacity of a drug molecule we have, based on that we can have the bioavailability. So how quickly and how much of a drug reaches its intended target, that is the site of action, and the factor that affect the absorptions, and therefore the bioavailability is included. Now, when we talk about the drug absorptions, then the small figure which clearly indicates that how the drug absorptions can be happen, you can understand the simple diffusion occurs after taking a drug administration. So absorption is started, but the small diffusion occurs, right? So after small diffusion, you can see that the passive aqueous diffusion is also take place. The another points, another in the way the passive aqueous diffusion is take place, which is very important for the drug molecule through the aqueous channel, right? Through the aqueous channel, you can see that lumen here. Okay, so for a small molecules, you can see that there is nothing but a passive aqueous diffusion, how it is take place, right? And you can see that whatever the fragments of the drug molecule we have, so for example, the small molecules with having 150 to 200 molecular weight of the drug molecule, if we can have, so that is passed through the passive aqueous diffusion. And the passive lipid diffusion, that is different thing rather than the passive aqueous diffusion. So when we talk about the passive lipid diffusion, so only the lipid soluble drug can cross this process. Lipid soluble drug can cross this process. You can see that this is the drug molecules with the particle size, and based on that from the lumens it can be passed to the another compartment in this way, right? So that's why, friends, with the absorption of a drug molecule, it is very important it is very important to have a the molecular weight for the different kind of drug molecules, and based on that we can have that absorptions, right? So friends, this is the another important terms as a drug absorptions. uh, Now, another things after the drug absorptions, you can see that after drug absorptions, the first pass hepatic metabolism is take place. First pass hepatic metabolism is take place. So after taking a drug administration, there are the steps which is shown here after taking oral drug administration. The absorptions from the gastrointestinal tract is happen, right? So you can see that the another diagrams where you can see that the label is there. Okay, so absorptions from the gastrointestinal tract, you can see it circulates towards the portal circulation. So the portal circulation is take place, okay, and then after it goes with the liver, it goes with the liver, okay, and then the systematical circulations is take place. So whatever the drug molecule we have, that after taking a oral drug administration, it passed through this gastrointestinal tract, and then it goes with the liver, and then systematic circulations is happen so in whole the body through this uh, blood-brain barrier. It is spread in all our body. So that's the things we have with this first pass hepatic metabolism. Now, I would like to show you that the low bioavailability. So, a high bioavailability as well as a low bioavailability. When we talk about the cause of a low bioavailability, a number of other factors may affect the absorptions as well as bioavailability of a drug taken by mouth. So, physical characteristic which includes how long the stomach takes to empty, and then second one, what are the acidity of a stomach and how quickly the drug is moves through the digestive tract. So other factor also included with the person age as well as the sex, as well as the level of physical activity and the level of stress. So according to these parameters, we can have the different kind of causes of the low bioavailability. So Sometimes we can have a high bioavailability, or sometimes we can have a low bioavailability. That it depends upon the route of drug administration, and according to that we can have a target. So friends, here you can see that the physical chemical factors affecting the oral absorption. So as I already explained, that the pH partition theory, as well as the lipid solubility of a drug, and the dissolution, and the pH, and the drug stability, and the hydrolysis in gastrointestinal tract, and the complexation, and then the absorption. So these are the physical chemical factors which are affecting the oral absorptions. And another way, you can see the factor affecting the drug absorptions, that is shown with this another slide, that is route of drug administration. It depending upon the route of drug administration, membranes physiology, then age of the patient, gastric emptying time, intestinal transit time, as well as the gastrointestinal pH, and the disease state, what kind of it is, and blood flow through the gastrointestinal tract, and gastrointestinal content. It may be food and drug interactions and fluids, another normal gastrointestinal contents, and the presynaptic metabolism by the luminal enzyme, as well as the gut well enzyme, and the bacterial enzyme, and hepatic enzyme. So friends, these are the physiological factors for this drug absorptions. Now, as we have seen that after taking a drug through the, with the various kind of routes, we have to think about the first point as a first tool as a drug absorptions. After taking drug absorptions, we have to check that the movement of a drug into the body, right, in the pharmacokinetics. So friends, this is the second term as a drug distribution. Now drug distributions, it refers to the movement of a drug to and from the blood and various tissue of the body. For example, fat, muscles, as well as the brain tissue, and the relative proportions of the drug in the tissue. So there is nothing but after drug is absorbed into the bloodstream, we have to see that the rapid circulations are throughout the body, right? So how the drug distribution is happen, that is shown here. As I already explained that the molecular weight of the drug molecule, it depends how the fragmentation is take place after the drug absorptions, and according to that we can have the drug distribution. Now let us see here the small thing that is shown with this figure. Friends, there is nothing but intracellular fluid level, and here the extracellular fluid level we have, and you can see that the plasma concentration and the blood plasma of the blood, and then you can see that the drug molecule, and then you can see that the fragments of the drug molecule, how it cross this capillary wall, that you can see it depends upon the characteristic properties of this the fragmentation of a drug molecule, and according to that it enters into the extracellular level fluid. So here you can see the drug dose, the drug of the size less than 50 daltons, that is passed over here and enter into the extracellular fluids. Now here the lipophilic drugs, that means the 50 to 60 dalton, we have the characteristic of a drug molecule that is entered over here, and then you can see here the polar and ionized drug molecule with the size that is a 50 dalton, that is entered into the extracellular level, and then after it cross these cell membranes. How this the cross the cell membranes, that you can see, if you can have a size less than 50 daltons, then easily they pass into the another the compartment, that means the intracellular fluids, there is a bulk flow, and here it is a passive diffusion, and here there is an active transport. So friends, this mechanism is very, very important to transform this drug molecule, their fragments, or maybe it binds together with the blood plasma, and they entered into the different compartment of the body. So that is very, very important in terms of the drug distribution. So friends, that is the drug distribution process. Now here, during the drug distribution process, the protein binding is very, very essential part of this body, right? Let us see here the whatever the plasma protein we have, that binding refers to the degree to which medications attach to the protein with the blood. A drug efficiency may be affected by the degree to which it binds. So the less bound of a drug is, the most effective it can it can traverse cell membranes of, or maybe the diffusion. And the common blood proteins that drug binds to the human serum albumin or the lipoprotein or glycoprotein or maybe the globulins, types of globulins, right? So friends, here another important the figure which is shown that the protein, and this is the drug molecule. So protein and drug molecule, how they bind together and they enters into the extracellular water. You can see here. Okay, so the protein bound together with the drug molecule. So you can see here with the extracellular water compartment, we can have the binding with this protein is observed, right? So drug bind together with the protein. You can see simply here with this extracellular compartment. So there is nothing but the protein binding is also important. Now, when I'm talking about the drug distributions in the body with the tissue level or the organ level, in general way, the volume of drug distributions is very important. And as I already explained that the VD, small VD, that means the volume of drug distributions, we may call it the volume of distributions as a parent volume of distribution, and it is used to quantify the distributions of a drug between the plasma and the rest of the body after taking oral dose or maybe the parental dosing, right? So that is nothing but it is based on the volume of distribution. It is also called the apparent volume because all parts of the body equilibrated with the drug and do not have the equal concentration. So apparent volume of drug distribution, that is called apparent volume of drug distribution, and it is defined as the volume in which the amount of drug would be uniformly distributed to produce the observed blood concentration. So we have to observe the blood concentration in the whole body. So apparent volume of drug distributions, you can see that the small formula it is shown here. Volume of drug distributions is equal to, there is nothing but the total amount of drug into the body. So whatever the total amount of drug distributed in the body in milligram, and whatever the concentration that we have to found out in the blood, that is milligram per liter. So we will try to find out this volume of drug distributions into the body. So large VD, that means it indicates that the long duration of action is there, right? So whatever the drug dose we have taken, if we found out a VD level that is high, that means the long durations of the action we can have. So that's the important terms as a apparent volume of drug distribution. Now, friends, the third important term that is the drug metabolism. So after taking a oral route of drug administration, one point I already explained that the drug absorptions. Then the second point we discussed the drug distribution, and third one that is the drug metabolism. Now, the drug metabolism, there is nothing but the biochemical changes we have to observe when we take this drug molecule. So the purpose of this drug metabolism, you can see that it facilitates the eliminations of a drug molecule into the body, different fragments of a drug molecule into the body that is happened, right? Let us see here, whatever the drug molecule we have, suppose if it is a lipophilic nature, so then the enzymatic reactions is happen and it metabolites to the polar fragments in the body. After it metabolism, that we can have the polar fragments, and then after you can understand the excretion is there, right? Drug metabolism is take place with the various route I will discuss with you in each example with the phase 1 and as well as phase 2, and then finally we can have the drug eliminations or drug excretion. It depending upon the what kind of that fragments we have with this drug molecule in the different part or organ level this in our body, right? Now without it the xenobiotics can remain identified into the body. It may lead to the formation of an inactive as well as a non-toxic compound, hence the terms is detoxification, right? However, the more recent studies have shown that some metabolites are not only active, but they may be a toxic. So, for example, if we have to take a drug molecule as a haloperidol, and then the metabolism process is take place in the body. So at that time, you can see that the changes are there. So here we can have this the complete aromatization. Here we can have the plus charge, and you can see that the double bond is formed here. with having plus charge with this nitrogen, and we eliminate this OH functionality. So there is nothing but we can have this haloperidol, but here we can have the changes with this ring system. So that's why we can have that the nature of the drug molecule that has been changed, and that's why the efficacy is take place. And then you can understand how the drug molecule then eliminates. So friends, in drug metabolism process, uh, let us see here the one drug molecule we have to consider over here, where the oxidation is take place in phase 1. I'm talking about the phase 1. That means whatever the drug molecule that is absorbed and then distributed, and then the metabolism process is started. So during the metabolism process, one of the important reactions is happened, that is called the oxidation. With the lipophilic nature of a drug molecule, the oxidation is take place, and then it may converts into this the ether form, and then we can have this the drug molecule may have the keto form, and then the glucothionate conjugations is also take place, and then after the elimination, drug excretion is also take place with these kind of fragments, right? Drug and these groups. So this is one of the way where with the first phase they may convert into this the ether form, right, cyclic ether form, and then whatever the aldehyde and ketone formation is also there, that it converts into this. Now another way when we talk about phase 1, in which the hydrolysis or maybe the reduction is take place to converts the drug molecule into these fragments with having the functionality OH as well as the RSH and RNH2 with the nucleophilic nature. And then in second phase, whatever the fragments we have with the drug molecule, they may be the sulfation as well as the acetylation as well as the glucuronidation is take place to have this kind of important conversion of the drug molecule. So there is nothing but the small fragments of the drug molecule is occurs in this way. Now let us see here with the figures, you can understand easily that whatever the drug molecule we have with the first phase, there is oxidation is take place. I already shown in earlier slide. Oxidation is happened where the cytochrome P450 is a very important the receptor, very important term we can call it for this oxidation reactions. And then you can see the second thing is also happened with this phase 1, that is reductive hydrolysis, and we can have the metabolites, right? So after metabolites process, we can have the polar species. As you know that haloperidol, it converts into the salt formation. So the polar species is converted, and then you can understand the drug eliminations is happened through the renal elimination, right? And in phase 2, when we talk about the phase 2, then as I already explained in earlier slide also, so friends, you can understand the conjugations is also happen as well in terms of the glucuronidation, sulfate as well as the N-acetylations is happen with the phase 2, and it gives the drug conjugation. So there is nothing but the adduct formation is take place, all right? So drug it forms the adduct, and then after whatever the adduct we have through this the non-polar species, as you know that RSH formations with the drug molecule, they can eliminate with this biliary eliminations is also take place. So friends, there is nothing but the huge things we can have after drug absorptions and distributions. So this kind of metabolism processes take place, and you can understand the importance of a drug molecule, how the metabolism processes take place in phase 1 and phase 2, and then drug can be eliminated in terms of the two important way, renal elimination as well as the biliary eliminations, that is understood from this figure. Now, the another terms I would like to discuss with you, that is enzyme induction. So it is a process by which the rate of a synthesis of an enzyme is increased and relative to the uninduced organism. For example, drug induce or enhance the expression of the enzyme, right? So drug that enhance the expression of the enzyme, that is shown with this the figure. Mechanism of enzyme induction, it is shown over here. So friends, let me try to show you this blue color, this figure, as well as this the yellowish color. So PXR is nothing but the pregnant X receptor, as well as another receptor, that is a retinoid X receptor. So friends, you can understand these two receptors, right? They can interact with this ligand, okay? they interact with the ligand, and you can see that the co-activation activators is there, and with this we can through this RNA polymerase 2 the functioning, in which you can understand the sequence of a DNA, how it binds together with the protein. So TBP is nothing but it's a binding with the protein, and the Tata is nothing but the sequence of DNA, which is shown here, how the sequence of DNA can be bind together with the protein, and then we can have this polymerase 2 kinds of reactions. And here you can see that CYP 3A4, right? So can play the important role for the other transformations, and we can have the ligand and OH. So there is nothing but the enzyme induction. So simply we can say that there is nothing but enhancement of the expression of the enzyme that can be changed by this transformation, right? So that is an enzyme induction. Okay, so it enhances the expression of the enzyme. Now enzyme inhibitors. Now another important terms as a enzyme inhibitors. So when we talk about these enzyme inhibitors, it is a molecule that binds to the enzyme and then decrease its activity, right? Enzyme inhibitors, that means the drug molecule or any other organic molecule that bind together with the enzyme, right? And it decreases its activity. It decreases their activity. Since the blocking an enzyme activity can kill a pathogen or correct a metabolism imbalance. The many drugs are the enzyme inhibitors. They act as an enzyme inhibitor. They are also used in the pesticides. And when we talk about these the types of enzyme inhibition, there are three kind of reversible inhibitors. One, that is the competitive inhibitors and enzyme inhibitors, and the non-competitive and the mix, or we may call it the uncompetitive inhibitors. Now here the competitive inhibitors, that means as the name suggests, the complete sorry compete with substrates to bind to the enzyme at the same time, and the inhibitors has an affinity for the active site of the enzyme where the substrate also binds to. You can see that the figure, from that you can understand the terms of the types of inhibitor, enzyme inhibitors. Now friends, one of the important figures that it shows that the competitive inhibitors, that means whatever the enzymes we have. So friends, you can understand this the shape and size of the enzyme that can be interacted with the substrate as well as the inhibitors. So friends, you can see that the complex formation is take place with the enzyme and the inhibitors. So you can see this the size of the surface area of this enzyme, specifically with this part, the quickly that inhibitors either it may be a drug molecule or any other compounds, that it interact with these sites of an enzyme, and we can have a complex molecules, right? Now whatever the substrate we have, so already this the active site of the enzyme is blocked. So that's why we may call it as an enzyme inhibitors. They already inhibits, because with the same shape and size it fit together, so it does not allow any other substrate to interact with this the enzyme. So already they block this enzyme with this complex formation. So that's why there is no reaction occurs. So inhibitors binds to the active site. You can see that the active sites where the inhibitors is bind, right? So that's why there is no reaction is happen. So directly it blocks the active sites. What are the active sites we have, that is already blocked. So that is called the competitive inhibitors, right? Now you can see that the reactions, when we talk about a reactions, the substrate, whatever the substrate we have, as we know that with the enzyme there is active sites, substrate will try to interact with these active sites and it will try to inhibit this after the complex formation it is already blocked, and then you can see that reaction occurs and it produces the molecules and the so there is nothing but here whatever the active sites we have, substrate can be interacted, that is blocked, active site is blocked, but then after it will try to change that the shape and size of this enzyme, and you can see that there is no again the active sites is remain, isn't it? So one of the reactions which is shown with the substrate, and as far as the inhibition is take place, inhibitors directly interact with the active sites, and then after there is no chance to have this the interactions with the substrate with the active sites of the enzyme. So that is called the competitive inhibitions. Now, non-competitive inhibitions, that means here you can see that inhibitors. Friends, the active site of this enzyme that is already open, and then inhibitors which will try to interact with the enzyme, right? So inhibitors does not affect these active sites of the enzyme, but with the another site of the enzyme that makes the complex formation. After making a complex formation, you can see that shape and size of this site of an enzyme has been changed. And then whatever the substance we have that will try to interact with the active site, but you know that it is not compatible with this size. So that's why again there is no reactions is happened. So that is called the allostatic site, allosteric site, right? So inhibitor binds to the allostatic sites here also only, and then there is no reactions is happened with the substrate as well as the active sites of this one, right? So because it changes the shape as well as with the active sites. Now, uncompetitive inhibitors. So when we talk about uncompetitive inhibitors, so friends, then here also with the enzymes, and you can see that the substrate and then the inhibitors. Inhibitor interact with this site of this enzyme, and then you can see that the substrate, when the inhibitors can again change the shape and size of these active sites, and then after you know that it will try to bind together with this substrate, and inhibitor does not prevent the binding site of the substrate. So here inhibitor does not prevent the binding site. So that means substrate can easily interact with this one. So this is called the uncompetitive inhibitions, right? So that is the three important terms as a competitive inhibitors, non-competitive inhibitors, and uncompetitive inhibitors. Now the last terms, that is the process of a drug elimination. Okay, so when we talk about a process of a drug elimination, so first three terms: drug absorptions, drug distributions, and drug metabolism, and the fourth one, that is the process of a drug elimination. So this is the fourth part of a ADME tools for the pharmacokinetics, right? So let us see here, when we talk about this process of drug administration, after drug metabolism process, you see here the process is involves the urine formation. That means nothing but any drug molecule that can be eliminated. How it is, that can be understood by this figure. Okay, so three important terms through this drug eliminations is happened. You can see that the glomerular filtration, and the another one the tubular reabsorptions, and third one that is tubular secretion. So friends, here you can see here the main important compartment. I am talking about the glomerular capillaries that is shown here, and the Bowman capsule we can have here. Okay, and then another part that is the peritubular capillaries. This is the peritubular capillaries and renal veins as well as the urinary excretions. And here at once whatever the drug distribution, drug metabolism process is completed, and then whatever the other fragments we have that is passed through this, that means the afferent arteriole, and here it is called the afferent arterioles, right? And here mainly it is happen, the four important terms is happen with this specifically Bowman capsule. One, that is the filtration, and another one that is the reabsorption is take place over here. Then again the secretion is also take place with this Bowman capsule, and then lastly you can see drug can be eliminated through the urinary excretion. So friends, these are the four important terms with this drug elimination: filtration, reabsorption, secretions, and then resecretion as well as the excretion is happened. So that is nothing but this is the process of a drug elimination, right? Now, friends, with the ADME tools for the any drug molecule for designing a drug dose, it is very important to see that the time course of drug action, right? Time course of drug action. Let us see here this diagram. Here the time versus the plasma concentration. You can see here. Suppose if we have to take a drug molecule orally, okay, then you can see these important points. Okay, so where there is nothing but it shows that the minimum effective concentration. This is the level where we can have the minimum effect of the concentration, drug concentration in the plasma, and the maximum effect of the drug concentration in the plasma. So this line, it indicates that. Friends, here drug absorption. After taking a drug molecule, it takes some time. Then the absorptions will be started through the tongue and then the other part of the body, right? And then this is the point where the minimum effect of the drug concentration is found at the plasma concentration level, right? That is with this point. Okay, and here you can see that it may be near about the 3, okay, 2.5 to 3. This is the time it requires for receiving this minimum effective concentration of drug in the plasma concentration. And then the absorption is started with the body, right? The actual absorption is take place, and here you can see that with this point, that means the plasma concentration, if it reach up to this 36 or 38, right? So then the drug distribution is started. So here the drug distribution is observed, and then after you can see here the maximum, this is the level, that is the maximum concentration of drug which is observed here, and then after the metabolism process is take place. That means the metabolism process is take place. That means phase 1 and phase 2, whatever the oxidation, reductions, and the other kind of the chemical reactions is happened, right, through the metabolism process. And then again you can see that the time, that is 10 hours or maybe the 9.5 hours, we can have this the drug eliminations which will start it from here, right? So drug eliminations will be started, and you can see that the time period where we can have the drug elimination, that can be actually started from this point, right? So after 11 hours or 12 hours, you can see that drug eliminations is started, right? And up to this 25 hours, with this time, suppose if we consider in hours, so then you can see that the complete drug eliminations is take place. So there is nothing but we have to identify that the duration of the action, where it is. So this is the point. I mean, this is the time I am talking about. So for example, here 3 or 4 hours, and then you can see that 9.5 hours, we can have the bioavailability maximum with this specific point, with the duration of the action that can be observed between this time, right? So there is nothing but the time course of the drug action is very, very necessary for the drug molecule. So here also you can see that the therapeutic effect, we have to measure the therapeutic effect with having this bioavailability. So time course of drug action, specifically it is shown with this oral route of drug administration. So as I already explained, the duration of the therapeutic effect with a specific time, maybe the 2.5 to 9.5, we can have the duration of the therapeutic effect that is observed. Okay, and you can see this the minimum therapeutic effect. This is the level where we can have the minimum therapeutic effect. Okay, and then the maximum therapeutic effect is there, or we may call it that the toxic effect, or this the maximum effect that can be observed with this point. And this is the therapeutic window. I will show you with how we can calculate the therapeutic effect of a drug molecule, that I will show you. Okay, so mainly the dose response curve 3. So friends, here drug dose response curve 3. Let us see here. These are the two important diagrams where it clearly indicates that the control dose responsive curve used in the populations and response is yes or no. Let us see here. Rather than this one, we will try to see this important thing as a therapeutic index. So friends, therapeutic index is nothing but the lethal dose of drug concentration, that is LD50, and the effective concentration of drug dose, that is 50. ED50, LD50 upon ED50. Suppose if we can have this lethal dose, right? So that is 400, and here the effective dose concentration ED50 value, that is 100. That means 4. So friends, whatever the therapeutic index we have, more then the efficacy of the drug molecule is more, right? So friends, here you can see here the therapeutic index is equal to toxic dose, that is 50, or we may call it the lethal dose. Instead of toxic dose, we may call it lethal dose upon the effective dose, that is ED50, right? So that will give you the therapeutic index. So suppose if we can have a higher therapeutic index, that means the drug have a more efficacy, more potency, right? So friends, there is nothing but in pharmacokinetics, this ADME tools is very, very important as a drug absorption, drug distribution, drug metabolism process, and the drug excretion. So that part I already discussed. That means how drug moves into the body in the pharmacokinetics that I already explained. And lastly, the acknowledgement. So thank you very much for the Gujarat University with the chemistry department who invited me for giving a talk in the refresher course. So this is my today's talk. So thank you very much.